Hello and welcome to the 2024 Blue Cross and Blue Shield Service Benefit Plan Benefits Summary. Today we'll discuss a lot of important information about our benefits and plans as well as helpful programs, resources and tools. We are proud to be the health plan that's always by your side. Today, FEP covers over 5.5 million members, including Federal and United States Postal Service, or USPS, employees and their families, and Federal and USPS retirees and their families. Learn why 99% of our members choose to stay with us year after year. Now we'll take a closer look at the benefits and coverage we offer. We offer 3 plans for every need and budget: FEP Blue Focus, Basic Option, and Standard Option. Take note of these icons. We'll use these throughout this presentation to show what each plan is eligible for. All FEHB plans offer 3 levels of enrollment based on your needs. Yourself with self only. Yourself and 1 other eligible family member with self plus 1. Or you and multiple family members with self and family. Eligible family members include your spouse or children. Before enrolling, think about who you'll need coverage for. No matter what plan you enroll in, all service benefit plan members enjoy a large nationwide network. That includes over 1.7 million doctors and hospitals and over 55,000 retail pharmacies in the U.S. What do we mean by preferred, or in-network, providers? They agree to accept our allowance as payment in full for their services. This limits the amount you pay out of pocket. As we mentioned earlier, there are benefits you get no matter what plan you enroll in, like our nationwide network of doctors and hospitals. Your benefits also include free preventive care from in-network providers, no referrals required to see specialists, coverage around the world and wellness rewards and discounts. Now we'll dive into the differences between each plan. FEP Blue Focus is built for your needs and wallet. As a FEP Blue Focus member, you enjoy a reward for getting your annual physical, lower premiums and your first 10 primary care and specialist visits for just $10 each. You must visit in-network providers under this plan. Basic Option members enjoy quality in-network coverage. That includes no deductible, out-of-pocket costs that are mostly copays, preferred and non-preferred drug coverage and an $800 Medicare Part B premium reimbursement for members with Medicare. Standard Option gives you the freedom to get care anywhere with coverage for in- and out-of-network providers. Standard Option members also get access to the FEP Mail Service Pharmacy, preferred and non-preferred drug coverage and up to $25,000 in coverage for assisted reproductive therapy, ART, services. Next, let's go over our coverage for 2024. Here's what you'll pay when getting care at a primary care doctor, specialist, mental health provider, virtual doctor visit through our telehealth provider and urgent care center visits across all 3 of our plans. Here's what you'll pay for medical emergency visits at the ER, lab work, diagnostic services and chiropractic care across all 3 of our plans. And lastly, here's what you'll pay for maternity visits, inpatient and outpatient hospital visits, surgery and ER visits for an accidental injury. If we're talking about out-of-pocket costs, it's important to keep in mind each plan's deductible. A deductible is the amount you have to pay for certain medical services and supplies before your health plan pays for their share. Here are the deductibles under each plan. Note that Basic Option members do not have a deductible. It's also important to know the out-of-pocket maximums for each plan. The out-of-pocket maximum is the most you will pay annually out of pocket for covered services that you receive. When you reach the out-of-pocket maximum for covered services, you no longer have to pay associated cost-sharing amounts for the rest of the year. Here are the out-of-pocket maximums under each plan. Here's what you pay biweekly in premiums for 2024. Most active employees pay their premium biweekly. And here are the monthly premiums for 2024. Most retirees pay their premium monthly instead of biweekly. We encourage you to visit fepblue.org/compare to view the differences between our 3 plan options and learn more. Now let's talk about some of the updates to the Service Benefit Plan in 2024. We'll start with Wellness Incentive Program updates. New for 2024, members can use their MyBlue Wellness Card at select Blue 365 retailers for non-qualified medical expenses. You can spend up to $150 at these retailers during the calendar year. We also enhanced the Blue Health Assessment, or BHA. The new assessment will be available January 1, 2024. Basic Option and Standard Option members can earn $50 annually when they complete the BHA. We are introducing a new online coaching tool called Daily Habits to replace the online health coach. With this tool, you will be able to complete activities related to your health and well-being. Basic Option and Standard Option members will earn $40 for each completed activity, up to 3, for $120 in total. With the introduction of Daily Habits, the online health coach will go away on December 31, 2023. Most online health coach goals take a few weeks to complete, so start them no later than Thanksgiving. You must complete your online health coach goals by the end of 2023, they will not carry over to 2024. We are introducing a new pharmacy benefit called the FEP Medicare Prescription Drug Program, or MPDP. This program helps eligible members with Medicare get reduced out-of-pocket costs for higher-cost drugs and additional covered prescriptions as part of their FEP premium. You can learn more at fepblue.org/MedicareRx. The Diabetes Management Incentive Program, the program where members could earn up to $100 for getting annual A1C tests, will end on December 31, 2023. Eligible Basic Option and Standard Option members who receive an A1C test prior to this date will be able to submit a claim to receive their incentive through the end of 2024. This change does not impact the Diabetes Management Program by Livongo. Next, in the ongoing support of our members' mental health and wellness, we will cover marital and family counseling for all members. Previously, we only covered individual counseling. We are also pleased to offer expanded coverage to support our members' reproductive care. Here's what's new. We will cover specific artificial insemination procedures and the associated prescription drugs for these covered services for all members. Members diagnosed with infertility can receive up to 3 annual drug cycles for in vitro fertilization, also known as IVF. Standard Option members with infertility can get any assisted reproductive technology procedure, also known as ART, not listed as an exclusion in the brochure. We will cover up to $25,000 annually once you receive prior approval. And finally, all members can get up to 40% in exclusive savings through Win Fertility's treatment program bundles via our Blue 365 discount program. Standard Option members can combine these savings along with their annual $25,000 in assisted reproductive technology coverage for greater assistance. Here are additional updates to our coverage for 2024. We will cover medically necessary genetic testing for members who may be at high risk for certain conditions. You must receive prior approval. We increase the copay by $5 for primary care and specialists for Basic Option and Standard Option members. Basic Option and Standard Option members must receive prior approval before buying hearing aids. FEP Blue Focus members do not have a hearing aid benefit. We increased the out-of-pocket maximum for FEP Blue Focus members. FEP Blue Focus members with Medicare Primary will no longer have their deductible waived. You must meet your FEP Blue Focus deductible before we'll begin covering your other medical out-of-pocket costs in full. For our members living or traveling overseas, we have a new overseas benefit provider, GeoBlue. You can learn more about overseas benefits at fepblue.org/overseas. Another change coming is that we will send new member ID cards in the fall of 2023 and early 2024. Each member in a household will receive a card in their name, not just the contract holder's name. If you enroll during open season 2023, if you're an FEP Blue Focus member or you enroll in our new FEP Medicare Prescription Drug Program, we will send you a new member ID card by December 31, 2023. Basic Option and Standard Option members not enrolled in the FEP Medicare Prescription Drug Program will receive their ID cards in early 2024. Keep in mind that these aren't all the updates for 2024. To see the full list, be sure to visit fepblue.org/brochure and download the brochures. Let's go over the Blue Cross and Blue Shield Service Benefit Plan's pharmacy benefits. We have 3 pharmacy programs for active employees to help them get their prescriptions conveniently and affordably: the Retail Pharmacy Program, the FEP Mail Service Pharmacy Program, and the FEP Specialty Pharmacy Program. Standard option members have access to all 3 programs. Basic option members without Medicare Part B primary and FEP Blue Focus members only have access to the Retail and FEP Specialty Pharmacy programs. Let's go over what each of these programs are. Through the Retail Pharmacy Program, members have access to a large network of in-network retail pharmacies. There are over 55,000 pharmacies in our network that include both national chains and local pharmacies. The FEP Mail Service Pharmacy Program allows you to get up to a 90-day supply of your medicine sent directly to your home. This program is available to all standard option members as well as basic option members with Medicare Part B primary. The FEP Specialty Pharmacy Program is available to members who take prescription drugs for complex health conditions such as cancer. These drugs will be mailed directly to your home or doctor's office. We organize our list of covered drugs on an approved drug list. This list is called a formulary. In general, the lower the drug's tier in the formulary, the more cost-effective the drug. See the full lists at fepblue.org/formulary. You can also check drug costs using our drug cost tool at fepblue.org/rx. Basic option and standard option have 5 drug tiers. Tier 1 are generic drugs, typically the most affordable drug type. Tier 2 are preferred brand name drugs. Tier 3 are non-preferred brand name drugs. Tier 4 are preferred specialty drugs. And Tier 5 are non-preferred specialty drugs. FEP Blue Focus only has 2 tiers of drugs, Tier 1 and Tier 2. Here's what you'll pay for a 30-day supply of your prescriptions at an in-network retail pharmacy. Here's what you'll pay for a 90-day supply of your prescriptions using the FEP Mail Service Pharmacy Program. And here's what you'll pay for a 30-day supply of your prescriptions using the FEP Specialty Pharmacy Program. You can learn more about our pharmacy programs by visiting fepblue.org/pharmacy. Now, let's review some of the wellness programs and tools available to Service Benefit Plan members. But before we get into the specifics, here's a quick overview of which plans are eligible for our wellness programs. Note, for many of our incentive programs you must be the contract holder or spouse on your plan and 18 or older. Let's start with the Blue Health Assessment, or BHA. With this online, or if you prefer, paper, assessment, you'll be asked a series of questions about your health. You'll then get a score and recommendations on how to improve or maintain your health in less than 20 minutes. If you've taken the BHA in the past, in 2024, you'll see an updated set of questions. And basic option and standard option members can still earn $50 the first time they take the BHA each year. We are moving from the online health coach to a new online coaching tool called Daily Habits. With this tool, you will be able to complete activities related to your health and well-being. Basic option and standard option members can earn $40 for each completed goal, up to 3, for $120 in total. Next is our routine annual physical incentive program, which is available to FEP Blue Focus members. Here, members can earn a reward for getting an annual physical. Choose from rewards, such as a personalized nutrition plan or a $150 My Blue Wellness card. When you complete wellness activities and earn an incentive reward, we load those rewards on a debit card called the My Blue Wellness card. If it's your first time completing an activity, we'll send you a new card in the mail. From there on, we automatically load the rewards to your card. Your funds don't expire for as long as you're a member of our plan. We'll go over what you can purchase with your card in the next few slides. The first way you can spend your reward dollars is on qualified medical expenses. These are defined by the Internal Revenue Service and include items like prescription drugs, acupuncture, eye exams and eyewear, doctor's office copays, lab fees and dental treatments. To see the full list of what's eligible, visit irs.gov/publication/P502. The next category, and new for 2024, is spending your reward dollars at select Blue 365 retailers for non-qualified medical expenses. You can use up to $150 annually on available discounts like fitness apparel and meal plan subscriptions. What if you want to pay for qualified medical expenses but don't have your MyBlue Wellness card with you? Don't worry. With our Reimburse Me tool, we can reimburse you for these costs. Just log into MyBlue, select Card Activity and select Reimburse Me. Once we approve the request, we will deposit the funds into your bank account. As you can see, we have many different programs and resources designed to help you reach your health goals. You can learn more by visiting fepblue.org/incentives. Now, let's take a look at how we can support your well-being. The Nurse Line gives you 24/7 access to qualified registered nurses if you ever have a health question or need guidance on where to go for care. And this service is at no out-of-pocket cost to you. Call 1-888-258-3432 or chat with them via your FEP Blue app or MyBlue account. Next, your telehealth benefit connects you with board-certified doctors by phone or video through Teladoc Health anytime, anywhere. Get care for general health, behavioral health, dermatology, nutritional counseling and, for overseas members, global care. On average, you pay less for a Teladoc Health visit than you would at the doctor's office. The first 2 Teladoc Health visits each year are free for all members on your contract. After that, there's a small copay for every visit. Keep in mind that all nutritional counseling sessions are always covered in full for all members. The Diabetes Management Program by Livongo is a no-cost program that provides basic option and standard option members with diabetes and advanced blood glucose meter, unlimited test strips, lancets and one-on-one coaching from a diabetes coach. What makes hypertension, or high blood pressure, so dangerous is that it often shows little to no symptoms. If you have high blood pressure, also known as hypertension, you can get help monitoring your blood pressure at home with a no-cost blood pressure monitor with the Hypertension Management Program. Through the Pregnancy Care Incentive Program, after a first trimester prenatal checkup, pregnant members can earn $75 and a pregnancy care box filled with items that they can use during and after pregnancy. In addition to the Pregnancy Care Incentive Program, if you are pregnant or nursing, you can receive a free breast pump kit and a supply of milk storage bags. You have a selection of electric or manual pumps. You can also receive a no-cost blood pressure monitor. Learn more at fepblue.org/maternity. We know tobacco sometimes feels impossible to quit. But we can help you quit for good with free tobacco cessation drugs, tools and resources from the Tobacco Cessation Incentive Program. These are the tobacco cessation drugs that are covered through this program, available at in-network retail pharmacies. Blue 365 gives members access to exclusive deals on health and wellness products and services, from personal care to travel. Plus, joining is easy and completely free. All you need to do is log into your MyBlue account. With Blue 365, you get deeper discounts than other health savings programs. Score hand-picked discounts from brands you love with no limits on how many deals you can redeem. There are always available deals and new ones constantly being added. Plus, you get exclusive offers only available for Blue 365 members. We can help you save at the pharmacy checkout. Through our discount drug program, you can save an average of 24% on prescription drugs not covered by your pharmacy benefits. You'll pay the lower cost between the discount price offered through this program and the pharmacy's regular retail price. In addition to our discount drug program, standard option members can get their first 4 generic prescription fills at no cost. Just purchase a brand name drug and then change to a corresponding generic replacement on the Generic Incentive Program drug list to get the benefit. You can learn more about these health and wellness programs at fepblue.org/healthwellness. Now, let's review some of the tools and resources that help you maximize your coverage. Our website, fepblue.org, is your destination for everything you need to know about the service benefit plan. You can access all of our important tools and resources there, plus a whole lot more. MyBlue is our member-only site that allows you to manage your healthcare. Check claim status, access tools and resources, and more. Here's how to get started with MyBlue. Visit fepblue.org/signup. Complete the registration fields. You'll need your member ID card and a unique PIN. Follow the instructions to get one. Log in with your new username and password. You can also download the FEP Blue app to manage your benefits on the go. Keep track of out-of-pocket costs. Find preferred providers. Use your digital member ID card. Access the 24/7 nurse line and Teladoc Health. And more. Download the app today from the App Store or Google Play. Need help comparing our 3 plans? Our product selection tool can help you find the plan that's right for you. Answer simple questions and you'll automatically get a recommended plan based on you and your family's needs. It only takes a few minutes to complete. You can try it at askblue.fepblue.org. Finding doctors and hospitals you trust is important. Use the Find a Provider tool to locate a trusted provider near you, no matter where you are. You don't need a referral to see a specialist with any of our plans. Easily search a network that includes over 1.7 million doctors and hospitals and over 55,000 retail pharmacies in the US. You can even search for certain treatments and get estimates for how much they'll cost. Visit fepblue.org/provider to learn more. If you take prescription drugs, it's important to know how much they cost. Use the prescription drug cost tool to see what your prescription costs under each of our plans and at different pharmacies. Learn more at fepblue.org/rx. Want to learn more about our benefits or different wellness topics? Easily search and register for in-person and virtual events. New events are added all the time, so check this page regularly. Go to fepblue.org/events to search and register. Scan this code to instantly access more resources to learn about FEP. You can also visit fepblue.org or call the National Information Center at 1-800-411-BLUE, 2583, if you have any questions. Along with our medical plan, we offer supplemental dental and vision plans. Visit bcbsfepdental.com and bcbsfepvision.com to learn more about each. Thank you for watching this presentation. We hope you learned a lot about our coverage.